What are the new sling materials for bladder incontinence? What are the new sling materials for bladder incontinence? This is an important question for many individuals dealing with urinary incontinence. Sling procedures are a common surgical intervention designed to support the urethra or bladder neck, helping to restore continence. Over the years, the materials used in these procedures have evolved significantly, aiming to improve effectiveness, reduce complications, and enhance patient comfort. One of the exciting developments is the introduction of adjustable synthetic slings. These innovative designs feature an active element that can be filled or tensioned to precisely regulate urethral closure pressure. This means that the sling can better conform to the unique anatomy of each patient, providing effective control over incontinence while minimizing pain and the risk of infection. These adjustable slings are particularly beneficial for men experiencing post-prostatectomy incontinence. However, they are still undergoing clinical evaluation to ensure their long-term safety and efficacy. Another promising approach is the use of hybrid slings that combine synthetic mesh with autologous tissue, which is the patient's own connective tissue. This technique aims to balance the durability of synthetic materials with the biocompatibility of natural tissue. By doing so, it may reduce the risks associated with purely synthetic slings, such as erosion or infection. Hybrid slings have shown promise in treating complex cases of stress urinary incontinence, especially for patients who have experienced complications with previous synthetic slings. Nonetheless, more long-term studies are needed to confirm these advantages. In response to concerns about complications from synthetic mesh, there is a renewed interest in non-mesh slings made entirely from the patient's own tissue. For instance, the pubovaginal sling utilizes autologous fascia to support the bladder neck and urethra. This method avoids the risks associated with synthetic materials and can be a suitable alternative for patients who may have contraindications to synthetic mesh. While these options are more invasive and involve longer recovery times, they provide a valuable choice for those concerned about mesh safety. Additionally, advancements in surgical techniques have led to the development of single-incision and minimally invasive synthetic slings. These newer designs focus on reducing the size of the implant and minimizing surgical trauma. Single-incision slings use smaller synthetic strips, which can lead to shorter operative times and decreased complications, such as bladder or bowel perforation. Despite some concerns and warnings related to certain mesh products, synthetic mid-urethral slings remain as widely used for stress urinary incontinence, with ongoing improvements in safety and design. It is essential to consider individual medical history when discussing sling procedures, especially for patients with a history of bladder cancer or those at risk. Previous treatments, such as radiation or surgery, can impact tissue quality and healing. In such cases, using autologous tissue slings or adjustable synthetic slings with gentle implantation techniques may be preferred to minimize complications. In summary, the newest sling materials for bladder incontinence include adjustable synthetic slings with active pressure elements, hybrid slings that combine synthetic and autologous tissue, and refined minimally invasive synthetic slings. Non-mesh autologous tissue slings continue to be a vital option for patients concerned about mesh complications. As research and clinical trials progress, these materials are being optimized for safety and effectiveness across diverse patient populations. If you are considering treatment options for bladder incontinence, it is crucial to consult with a healthcare professional to determine the best approach for your specific situation.